Good morning to my respected teachers and my dear friends. My name is Yamuna Chetri and I am giving a presentation on the topic of CPR. CPR, which stands for cardiopulmonary resuscitation, which means cardio meaning heart circulation, pulmonary meaning lungs and respiration, resuscitation meaning to try and revive. Now let's discuss with the introduction part of the CPR. CPR is first aid technique used to revive the heart and lungs, prevent the patient from going into biological death. As we all know that the heart and lungs are two important organs of the body for maintaining circulation and exchange of oxygen by taking out carbon dioxide from the body. They are important for the survival of the patient. If both these organs fall, then the person is said to be clinically dead. Clinical death is therefore defined as the moment when breathing stops and the heart stops beating. Time interval between clinical and biological death is 4 to 6 minutes. Now, biological and clinical death. Biological death means if a person is not receiving oxygen, brain cells will begin to die within 4 to 6 minutes, in which we can say that a patient is biologically dead when the brain cells die. Clinical death. Clinical death is when the heart stops beating and is reversible, but biological death is irreversible. CPR is the procedure by which you try to prevent biological death. During this procedure, the patient's heart is squeezed between the breastbone, which is also called sternum, in front and backbone at the back, with the patient lying on his back. As the heart is squeezed, blood is forced into circulation. When pressure is released, blood flows back to the patient's heart. When you provide CPR, your breath allows oxygen to be taken up by the blood, and your compressions allow for this oxygenated blood to be circulated to the body cells. CPR is as easy as CAB, which stands for compression airway breathing. Definition of CPR. Cardiopulmonary resuscitation is an emergency procedure that combines chest compressions, often with artificial ventilation, in an effort to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation and breathing in person who is in cardiac arrest. In which we can say that CPR is the emergency technique for recognizing and treating upper airway obstructions and failures of the respiratory system and heart. Now, the purposes of cardiopulmonary resuscitation. CPR. CPR is performed to restart the heart. Its main purpose is to restore partial flow of oxygenated blood to the brain and heart. The main objective is to delay tissue's death and to extend the brief window of opportunity for a successful resuscitation without permanent brain damage. It is also used to maintain, its purpose is also to maintain an open and clear airway, to maintain breathing by artificial ventilation, to maintain blood circulation by external cardiac massage, to save life of the patient, to provide basic life support till medical and advanced life support arrives. Now let's see some chest compressions. The depth of chest compressions is about 2 to 2.5 inches for adults with both hands, as I have shown you in figure, and about 1 to 1.5 inches for children by using only one hand, and about 1 to 3 inch for infants with 2 fingers. Earlier, AHA guidelines emphasize ABC as CPR guidelines, in which A stands for airway, which means that the person giving CPR needs to make sure that the airways are open. B stands for breathing, which means that the person giving CPR does mouth-to-mouth breathing, and C stands for chest compressions. But according to New Year guidelines, ABC has been replaced by the term CABCAB. Consequently, mouth-to-mouth breathing has now become the third optional portion of CPR. The primary reason for the change is that most of the people who provide CPR or who give CPR to the person or patient hesitate to use mouth-to-mouth breathing with unknown people, because mouth-to-mouth breathing may cause spread of infectious diseases and some common causes of CPR. There are many different causes for breathing problems which require CPR. For example, asthma, being at a high altitude. जब आप high altitude में जाओगे तो you'll have problem in breathing. In that you must require CPR. Blood clot in the lungs में blood clot हो जाना, chronic obstructive pulmonary disease COPD, collapsed lung, heart attack, heart disease or heart failure, injury to the neck, chest wall or lungs, respiratory infections including pneumonia, acute bronchitis, whooping cough, and others. Now, indications for CPR. CPR should be performed immediately on any person who has become unconscious and is found to be pulselessness. हम लोग CPR immediately दे सकते हैं जो आदमी unconscious हो जाए और उसका पल्स नहीं होगा, found to be pulseless. Assessment of cardiac electrical activity via rapid rhythm strip recording can provide a more detailed analysis of the type of cardiac arrest as well as indicate additional treatment options. Cardiac arrest, which includes ventricular fibrillation, ventricular tachycardia, asystole, pulseless electrical activity. This also comes under indications for CPR. Ventricular fibrillation means it is a rapid, life-threatening heart rhythm starting at the bottom chambers of heart. It can be triggered by a heart attack. Ventricular tachycardia means this is a condition occurs in which the lower chamber of the heart ventricles beats very quickly. Respiratory arrest, which includes drowning, stroke, foreign body airway obstructions, smoke inhalation, drug overdose, accident, suffocation, coma, and etc. Now, criteria for CPR. CPR देने के लिए पेशेंट को क्या क्या होना चाहिए, क्या क्या क्राइटेरिया होना चाहिए. वो अनकॉन्शियस होना चाहिए, उसका पल्स नहीं एब्सेंट होना चाहिए, ब्रीदिंग एब्सेंट होना चाहिए. उसके बाद में पेशेंट मस्ट लाई ऑन ए हार्ड फ्लैट सरफेस, वो एक हार्ड फ्लैट सरफेस का ऊपर होना चाहिए. लेग शुड प्रिफरेबली बी एलिवेटेड. Some complications of CPR are CPR किस किस पेशेंट के ऊपर हम नहीं दे सकते हैं. Some complications like fracture of ribs के ऊपर में we cannot press the fracture ribs. Injured to internal organs such as heart, lungs, liver, stomach and spleen. Bloating, vomiting. Bloating means a build-up of gas in the stomach and intestine. Stomach और intestine के अंदर gas build-up हो जाना. Principles of CPR. We have to define the team leader, establish effective artificial circulation, effective oxygenation and ventilation, establish a route for medication administration, create an effective cardiac rhythm, evacuate the patient to the ICU as soon as practical, re-evaluate and stabilize, preserve the brain to restore effective circulation and ventilation, to prevent irreversible cerebral damage due to anoxia. When the heart fails to maintain the cerebral circulation for approximately 4 minutes, the brain may suffer irreversible damage, which is called clinical death. Irreversible is a biological death. Now, the general instructions for effective CPR. So, number 1 is lay the person flat on his back. Number 2, place your hand flat on the person's upper chest between the nipples. For infants, only 2 fingers are used. As I have already shown you in that figure, the middle finger and the index finger. For adults only, place your hand above the first hand. For children, only one hand is used. Number 3, start applying pressure to compress the chest. Number 4, the recommended rate of chest compression is about 100 per minute. A short description of cardiopulmonary resuscitation (CPR). CPR is a part of the emergency cardiac care system designed to save lives. Many deaths can be prevented by prompt recognition of cardiopulmonary arrest and notification of emergency medical system, followed by early CPR. Defibrillation, which delivers a brief electric shock to the heart in attempt to get the heart to beat normally, and advanced cardiac life support measures. CPR must be performed within 4 to 6 minutes after the cessation of breathing to prevent brain damage or death. CPR 4 to 6 मिनट में ही उसका बाद ही करना है जब ब्रीदिंग स्टॉप हो जाते हैं to prevent brain damage or death. CPR consists of rescue breathing, which delivers oxygen to the victim's lungs, and external chest compressions, which help to circulate blood throughout the heart to vital organs of the human body. CPR technique differs for infants, children, and adolescents. The American Heart Association and the American Red Cross, the two organizations that provide CPR training and guidelines, distinguish infants, children, and adolescents for the purposes of CPR are as follows. Infants includes neonates, those in the first 28 days of life, and extend to the age of 1 year. Children include toddlers 1 year to 8 years, adult 8 years and above or and older. These are divided according to age groups because infants and children under the age of 8 have smaller upper and lower airways and faster heart rates than adults. CPR techniques are different for them than for older children and adults. Children and adolescents aged 8 years and older have reached a body size that can be handled using adult CPR techniques and are thus classified as adult for delivery of CPR and life support. CPR is always begun after assessing the victim and contacting EMS. Performing CPR on an infant. For an infant, the rescuer opens the airways using a gentle head tilt, chin lift, or jaw thrust. Places their mouth over the infant's mouth and nose, then delivers gentle breaths so that the infant's chest rises with each breath. Chest compressions are delivered by pressing two fingers of one hand. As I said, index finger and middle finger over the lower half of the infant's sternum. Over the lower half of the infant's sternum, slightly below the nipple line, and pressing down about 1/2 inch to 1 inch. Chest compressions are delivered at a rate of 100 times per minute, giving 5 chest compressions followed by 1 rescue breath in successive cycle. Performing CPR on a child age from 1 to 8. For a child age 1 to 8 years, the compression rate is the same, 5 compressions and 1 rescue breath. Rescue breaths are delivered using a mouth-to-mouth seal. Instead of mouth-to-mouth and nose, chest compressions are delivered by placing the heel of one hand over the lower half of the sternum and pressing about 1 to 1 and 1.5 inches per compressions. Performing CPR on a child aged 8 and older. For a child aged 8 years and older, and for larger children under age 8, 2 hands are used for compressions. First, as I said before, first one hand over another with the heel of one hand on the lower half of the sternum and the heel of other hand on the top of that hand. The chest is compressed about 1.5 to 2 inches per compressions. Rescue breaths are delivered with a mouth to mouth. The compression rate is 80 to 100 per minute, delivered in cycles of 15 compressions followed by 2 rescue breaths.